In this video, we're going to be covering topics like types of diabetes and the prevention and management strategies. Diabetes is a chronic condition that affects millions of people worldwide. It occurs when the body is unable to produce or use insulin properly, leading to high blood sugar levels. There are three main types of diabetes: type 1, type 2, and gestational diabetes. Each type has unique characteristics and requires different management strategies. Type 1 diabetes is an autoimmune disorder that occurs when the body's immune system attacks and destroys the cells in the pancreas that produce insulin. This results in a complete lack of insulin production and the need for lifelong insulin therapy. Type 1 diabetes usually develops in childhood or early adulthood and accounts for approximately 5 to 10% of all diabetes cases. Symptoms of type 1 diabetes include increased thirst and urination, unexplained weight loss, fatigue, blurred vision, and frequent infections. If left untreated, type 1 diabetes can lead to serious complications such as diabetic ketoacidosis, which is a life-threatening condition that requires immediate medical attention. Management of type 1 diabetes involves regular monitoring of blood sugar levels, insulin therapy, and a healthy diet and exercise plan. People with type 1 diabetes must carefully balance their insulin doses with their food intake and physical activity levels to maintain stable blood sugar levels. They may also need to check their blood sugar levels several times a day using a glucose meter. Type 2 diabetes is the most common form of diabetes, accounting for approximately 90 to 95% of all cases. It occurs when the body is unable to use insulin properly, leading to high blood sugar levels. Type 2 diabetes usually develops in adulthood, but it can also occur in children and adolescents. Symptoms of type 2 diabetes include increased thirst and urination, blurred vision, fatigue, and slow wound healing. Risk factors for type 2 diabetes include obesity, a sedentary lifestyle, family history of diabetes, and certain ethnicities such as African Americans, Hispanics, and Native Americans. Management of type 2 diabetes involves lifestyle changes such as healthy eating and regular exercise, as well as medication if necessary. People with type 2 diabetes may also need to monitor their blood sugar levels regularly using a glucose meter. In some cases, they may also need insulin therapy. Gestational diabetes is a type of diabetes that occurs during pregnancy. It usually develops in the second or third trimester and resolves after delivery. Gestational diabetes occurs when the hormones produced during pregnancy interfere with the body's ability to use insulin properly, leading to high blood sugar levels. Symptoms of gestational diabetes include increased thirst and urination, blurred vision, and fatigue. Risk factors for gestational diabetes include a family history of diabetes, obesity, and certain ethnicities such as African Americans, Hispanics, and Native Americans. Management of gestational diabetes involves regular monitoring of blood sugar levels, healthy eating, and physical activity. In some cases, medication may also be necessary. Women with gestational diabetes are also at increased risk of developing type 2 diabetes later in life and should be monitored regularly. Prevention and management strategies. Prevention and management of diabetes involve several strategies which include healthy eating, regular exercise, medication if necessary, and monitoring of blood sugar levels. A healthy diet for people with diabetes should include a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats. It is also important to limit processed and sugary foods and beverages. Regular exercise is also important for managing diabetes. Exercise helps to improve insulin sensitivity, which can help to lower blood sugar levels. It is recommended that people with diabetes engage in at least 150 minutes of moderate intensity exercise per week, such as brisk walking, cycling, or swimming. Medication may also be necessary for managing diabetes. People with type 1 diabetes require lifelong insulin therapy, while those with type 2 diabetes may require oral medications or insulin therapy. Medications can help to lower blood sugar levels and prevent complications of diabetes. Monitoring of blood sugar levels is also important for managing diabetes. People with diabetes should check their blood sugar levels regularly using a glucose meter. This can help to identify trends in blood sugar levels and adjust medication and lifestyle strategies accordingly. In conclusion, diabetes is a chronic condition that requires lifelong management. There are 3 main types of diabetes, each with unique characteristics and management strategies. Prevention and management of diabetes involve healthy eating, regular exercise, medication if necessary, and monitoring of blood sugar levels. It is important for people with diabetes to work closely with their healthcare team to develop a personalized management plan and prevent complications of the condition.